Welcome, everybody. Thanks so much for joining in. My name is Dr. Archana Shrestha. I'm one of the co-founders of the Women in White Coats blog, and I'm so excited to be talking today with one of our top 12 Women in White Coat heroes for 2020, Dr. Mary Mason. Welcome.
Well, thank you for having me.
So I'm going to tell everybody more about you and go ahead and read your bio. So Dr. Mary Mason, MD, MBA, is the founder of Little Medical School, a children's educational franchise which has inspired over 350,000 children from around the world to consider careers in healthcare. She has 20 plus years of experience in the corporate and educational world, designing clinical programs that improve health outcomes and literacy. Dr. Mason earned her Bachelor of Science degree in bioengineering at the University of Illinois and her MD and MBA from Washington University. She completed her clinical training at the Washington University School of Medicine in Barnes-Jewish Hospital, where she was chief resident for the Department of Medicine. She is board certified in internal medicine, is a fellow of the American College of Physicians, and a member of the Alpha Omega Alpha Medical Honorary Society. An active member in the community, Dr. Mason serves on the board of OASIS, Parents as Teachers, and the Washington University National Council for the Institute of Public Health. She has also been recognized as a member of the 2008 class of 40 Under 40 and 2016 class of Most Influential Businesswomen by the St. Louis Business Journal. Most recently, Dr. Mason received the 2019 Washington University School of Medicine Alumni Achievement Award. So Dr. Mason, you've been up to so many great things, and I definitely want to talk about all of them. But let's get started, first of all, with what drew you into medicine? What made you decide to pursue a career as a physician?
Well, I'm a doctor's kid, and so important to my career choice was my mother was a pediatrician, and she was one of four women in her class in medical school in the 1950s. And you know, when I was a kid, she was always trying to come up with fun things to do, trying to inspire me and my siblings to go into medicine. And so she would bring home, you know, tongue depressors, cotton balls from the office. I had a little white coat, stethoscope, my little black doctor's bag. So I had my own little doctor's office in my playroom. And so those were, you know, and when I looked back, you know, originally I started in engineering because I wanted to make absolutely sure I wanted to go into medicine and wasn't doing it just because, you know, I grew up in a medical household. But really, I started to realize how important those early experiences were, because it wasn't only about telling me, you know, you can be anything you want to be, you can be a doctor, but it was really that work hard and you can achieve it. And so that's really how I ended up in medicine. I always loved business. And, you know, and it was great because when I started Little Medical School back in, when I was a chief resident, it really was I was bringing, you know, able to have my worlds collide, because I was able to bring my, you know, everything I'd learned in medicine, everything I had from my childhood experiences, and then bring that business skill set to the table as well.
Yeah, and so when did you decide to go into to business school? Was that like after residency, or were you doing that simultaneously as medical school or residency?
Yeah, that's a great question. And what I ended up doing was I wanted to first go through medical school. I looked at some of the combined programs, MD, MBA, but I decided, you know, WashU was a really great fit for me. They didn't have that track. But what ended up happening was after I finished residency and I was offered a chief year, they wanted you to take off a year and either, you know, most people do a fellowship. And so I went to the chairman and said, could I go to business school? Are you okay with that? And so I ended up doing full-time MBA that year and then doing hospitalist work at night. So I didn't lose my clinical skills. And then when I finished that year and started to be a chief resident, I finished up part-time. And so it was when I finished my chief year, I had my MBA as well.
Okay. And what was it that drew you to get your MBA? Was it just something that you were always interested in as well?
I really liked project implementation. And I know we talked about being fellow University of Illinois graduates. I got very involved in student government and a lot of the campus programs when I was there. And I really loved putting together strategy, and I loved that implementation part of the projects. And when I started to get into medicine, even though I loved basic science and I loved, really seeing, everything we were learning in medical school and how to take care of patients, I was always kind of seeing that's a great opportunity to, do better and have better quality of healthcare. And so it really was something that, to me, even though people often say, wow, MD, MBA, that's so different, it's really not. It just really is, it gives you just a new way to look at things.
Yeah, and there's certainly the whole business side of medicine, and that, no matter how remote you might think you are from it, you can never get away from it, whether you're in private practice or even academic practice or community practice. There's always still the business of medicine that's kind of coming into the clinical side,
Absolutely. And that's really, it's, and it's something, it's just so interesting because, now you're starting to see more and more people go in, getting the business background with medicine, which, I think is great. So I know I've been so happy with those choices that I made.
That's wonderful. And I'd love to hear, what was the impetus, or how did you come up with the idea of Little Medical School? What was the idea, and what sparked that?
Yeah, so when I was, like I said, I always was trying to do projects for the community. And when I was, in residency, this is back before the whole work hours where you were still working, 80, 90 hours a week. And, and I noticed that a lot of my fellow residents, they were so tired, and they just didn't have that connection with the community and anything outside of what they were doing as a resident. And a lot of them had forgotten, why did you become a doctor in the first place? So when I became chief, I decided that I wanted to, get a program up and running where the residents could connect with kids. Because I figure, you're going to go out and teach, and what better way to, remind yourself why you went into medicine than to talk to a room of 12-year-olds about healthcare careers and the body and being healthy. And so that's really where Little Medical School came out of in 1999. And, I still remember, our first class, we went into some of the middle schools in downtown St. Louis. And, these were some of these schools, the kids, was a little bit, some of the disadvantaged kids were in these schools and underserved kids. And a lot of them, I have to say, they were being silly. They're, a lot of them actually, were, why are you talking to me about being a doctor? I can't do that. I'm not that smart. And it's like, wait a minute, stop. You can do this. And so what I found is that's when I came up with this whole idea of the role play, where I brought in a bunch of white coats. I had stethoscopes. I bought a bunch of cheap nursing stethoscopes at the time, made the kids put them around their neck, and it just completely transformed the classroom to the point where the kids, because they could see themselves, visualize themselves in that white coat, I tried to come up then with activities, doing things like doctors do. So teaching them how to do surgery and, tie knots and try to, really trying to see, different procedures that doctors do. And so that's where it really came out of, and it's just grown from there. But it really, we always, to this day in all of our classes, we still do a white coat ceremony, and the kids wear their white coats through all of our programs.
I love that story. That's so wonderful to hear that when they put on the white coat, they started to act different, and they started to kind of maybe see that this is a possibility for them. Have you had kids who did those programs now? I know it started in 99, so I don't know if there's been enough time, but like go on to choose medical careers or become doctors?
We get stories all the time. And I have to laugh because, a lot of times where I hear is where my friends who are physicians will call me and say, thank you so much for telling my kid that they can do this, because they wouldn't listen to me. And I'm like, It's just kind of funny when they hear it from someone else. But no, we have so many great stories of kids. And it's not only about being a doctor. I mean, we try to expose them to every type of career. So nursing, pharmacy, dentistry, because maybe you want to be a dental tech, or maybe you want to be a dietitian. And so what we're really trying to do is let them see there's this amazing world of healthcare out there. And so, yes, we actually have stories of, where people will call me, where kids who, in fact, there was one scholarship program we were doing, and this camp called me because this little girl, she was having a really tough time at home. She was probably about 10, very quiet. First couple classes, she just sat there and really didn't say anything. And they weren't sure if she was engaged or not. And so she went, and then she started to get a little more talkative through the class. And then at the end, they went through the big graduation, and, she seemed, and she was starting to warm up a little bit. But then 2 weeks later, they went on a field trip with this camp, and someone started hiccuping. And the camp counselor's like, "Oh, you swallowed some air." And she raises her hand and she said, "I think your diaphragm is contracting. I learned that at Little Medical School." And, all of a sudden now they called me and said she was being so much more engaged. She's now kind of the camp doctor where people come to her. And she now says she wants to be a surgeon. So she is probably in 6th or 7th grade now. That's the one thing that's hard for me, is we always don't get good records to track the kids because it's an after school or summer camp. But it is, we also know we have had a lot of instructors who started with us when they were in college who now are actually attending. So that to me is incredibly exciting.
That's wonderful. And I think that, so much has changed, because when I was a little girl, I also am the child of a doctor. My mom is a family doctor.
Yes.
So I grew up seeing a woman doctor, right? But I think a lot of little girls, they may be directed towards the healthcare field, but then are told to become nurses and not necessarily doctors. So I think that that's, not that there's, obviously both are great choices, but we shouldn't just assume just because they're a girl that they should only become a nurse or strive to be a nurse, but that they could also have any other opportunities too. I mean, assuming they do the work and get the grades that they need to get.
Well, it's the flip side with nursing, where when we were working originally on our first little nursing school, one of the things we want to do is, how do you attract more men into nursing? And so, the thing that I've really liked, have really been so happy with our classes, is that we really get a pretty good split between boys and girls. And even with little pediatrician school, they get this cute little baby that they use as their patient through the class. And, to see a 9-year-old boy hugging this little baby, and really, we actually take them back between classes and give them to them at graduation, because kids lose things. I know this as a mother of 3, we always want to make sure they have everything for class. But, just to see, classes that I thought wouldn't resonate, based on gender, I haven't found that. I found that it's pretty universal. And the other thing that's been really exciting for me is we can be in the most underserved school, and we can be in the most high-performing private school. And it's a really universal curriculum, because it's really this intersection between education and healthcare professionals. And really, when you look at our curriculum and the supplies we use, we created all from scratch, because all we could find was worksheets, for kids. And we really want kids to be an active part of the learning. So even a lot of the supplies that we've developed over the years, like surgery lacing boards to do Tommy John surgery, we've created them all by ourselves. And those are all part of our curriculum.
That's interesting what you're saying about, the 50-50 split of boys and girls, doing the nursing or the doctor kind of roles. And, I think, I still get that when I go to see patients. Sometimes I'm wearing my white coat, and then I'll walk out of the room, and the male patient will say, "Well, when is the doctor going to come see me?" And the nurse will say, "That was the doctor. That woman in the white coat was your doctor." And so I think it starts at these young ages, kind of breaking those stereotypes, where the little boys are seeing, well, some of the girls are doctors, and then girls are seeing, well, some of the boys are nurses, and it's all fine, because I've definitely been in patient rooms where with a male nurse, and I'm the doctor and he's the nurse, and sometimes they're confusing the roles, that he's the doctor and I'm the nurse. So I think it starts, and so wonderful, even if these children don't go on to go into the healthcare field, at least we're kind of breaking some of these stereotypes.
Absolutely. And, we've also found that it's not only that, but it's about life, learning life skills. When we started wilderness medicine, because we actually have a classroom here in St. Louis where we test all our curriculum. And I remember I was so surprised when we were doing our focus groups because we had a manual compass. And a lot of the kids were looking at it going, what is this? And they're like, I think I have one on my phone. And it's like, okay. And then you start talking to them about, like how to be a safe rescuer. We give them the scenario of, you're hiking with your friend in the woods, they fall into a ditch. What do? They all say, call my mom or dad on my cell phone. And it's like, no, your cell phone doesn't work. What do? And they just look at you. And you kind of realize that, there's so many life skills that where kids with technology now have either lost or, because they don't have to figure it out themselves, they can just call somebody on a cell phone, or they're doing classes that aren't, more technology driven versus like we used to do with Scouts. So I think there's a lot of great life skills we're bringing to the table, but also how to be a good patient. Because another really important message we have is that if you're going to be a healthcare provider, you have to be a good role model. That means you need to exercise, you need to eat right, you need to go to the doctor, get your immunization. So there's some really great lessons there as well.
Oh, that's wonderful. I love that. Yeah, I think definitely kids today, I need those life skills, because everything is like Googleable, right? Like you can just Google everything or just, it's just all readily there. But like, yeah, what happens when that technology goes down, or, all the little soft skills that we need to have. There's all those little things, but
there are, and that's funny too on the gender, what you were talking to earlier about stereotypes. The other thing that I've really seen, at least with girls, is that a lot of them are very scared of STEM. And, and I say this as an engineer, and I remember sitting in class where there's like, just a handful of girls. And it's great now that you're seeing, with STEM being so much more important, that you're seeing a lot more girls going into engineering, coding, and robotics. But the one thing that we've kind of have been noticing is that there's a lot of girls, and boys too for that matter, but they don't like engineering. They don't like robotics or coding. And so they take that as, I don't like science. I can't go into science. And I have started to talk to a lot of schools, and we're getting a really interesting dialogue on this, because healthcare is not always thought of as STEM, which always kind of surprised me. And even if you look at some of the original projections on STEM jobs, healthcare is not in there. But what we try to do is, if we can provide our classes as well in schools when they're providing these other STEM curriculum type programs, it gives a very well-rounded experience, because you may not like coding and you don't want to be an engineer, but maybe you want to be a veterinarian or a pathologist or, a physiatrist. So I think that too is really important for kids, just to see the full picture.
Yeah, that's such a great point. I completely agree with that, because I could, even myself as a kid, I did a lot of science, but I always gravitated more towards like the biology side of things, or chemistry, and I did physics, of course, as like a prereq, and I enjoyed it to some degree, but I was like, I don't think I could be an engineer. I actually grew up with a mom who was a doctor and a dad who was an engineer. So I kind of was like, I could see both sides of it. And definitely, I think a lot more women could definitely connect more to the medical or side of things, because there's also that interaction with the patients that kind of a lot of women and girls like, that social interaction, of course, as well, as opposed to necessarily being behind a computer all day, or that type of thing. So which coding would lead to. But one thing I was just going to ask is, how have parents reacted overall, and teachers, to the little medical school and all that you're doing with that, in terms of like the children and what they're seeing, the changes that they see in the children?
It's really been great. And I have to tell you, I remember in the beginning, anytime I knew a physician's kid was coming, I'd be like, oh gosh, and I was just like, well, they like this. And, it's really been this very overwhelming, positive response. What, the thing that we really like to do is we always do a big graduation ceremony. and they take the little medical school oath, like our Hippocratic oath. And we always throw the kids some small, the snowball questions, and they get this really nice diploma, and they get to, they sign each other's diplomas, and it's like this really big celebration. A lot of times I'll get like a superintendent to come in or the principal to do it. And, the thing that I think for parents is that they always are so surprised what their kids can learn. And, for example, we've just have found so many, you taking all these great lessons from the education world and then taking the knowledge of healthcare, we've really have been able to take these really simple, these, complex healthcare concepts and make them simple. One example is we do a like digestion. So with second and third graders, we make an assembly line, and we do, one kid's the mouth, one's the esophagus, stomach, in small intestine, large intestine. And so, you're passing this bucket down. And so the kid who is the, small intestine has a strainer, and they're scooping out the nutrient, the little, magic beads that we've dissolved. And so they can tell you that's what the small intestine does. And, or you're throwing a sponge in for the large intestine to soak up all the extra fluid, and then they can tell you these type of things. Or we make blood with those red water beads and cotton balls for the white blood cells, and we put some little sparkly platelets in, and then we show the kids what sickle cell anemia is or what leukemia is. So the parents, I think, often are so surprised because we're using these really innovative educational techniques that in exercises what you can teach your kids. And that's really been the best response that I've got. And honestly, I always get people asking me, how many doctors have you had, out of your programs? And, to me, that's not even what I'm looking for from success. If some kid comes in and learns something about their body, learns how to be a better patient, has opened their eyes to maybe paying more attention in biology or math, you know what, that to me is the great success. And so that to me is very satisfying.
I agree completely. That is must be incredibly satisfying. And I want to congratulate you again for all the great work that you're doing, and you being a hero, a Women in White Coat Hero nominee. And we can't wait to celebrate you and recognize you at our Hero Ceremony. For everybody who's listening and watching, we want to have you all there attending to meet Dr. Mary Mason, as well as all the other top 12 Women in White Coat heroes who will be there. And it's actually a part of our conference, which is from April 30th through May 2nd. So if you register for the conference, you'll also get a free ticket to join the Heroes Ceremony and dinner. And we'd love to have as many of you as possible there. It's going to be a really, really great event, a really awesome time to relax and rejuvenate, but also grow and connect. And we're going to have 10 hours with CME at this really gorgeous resort just outside of Atlanta. So be sure to head on over to womeninwhitecoats.com/events to learn more about it. And I want to just congratulate you again, Dr. Mason, and thank you so much for taking the time to talk with me.
All right. Thank you again.